Hi there, Dr. McCoy at Drummond Chiropractic here. I'm going to go over a couple things for my golfers. The biggest things we see when patients come in that are avid golfers and are having problems out on the course is mobility issues in their thoracic spine or in their hips. So that allows you to rotate fully. You use both those areas mainly in the golf swing to get that rotation so you can get that torque before you come down and hit the ball. If you have restrictions or stiffness in either one of those areas, it can affect your golf game quite a bit. So I'm gonna go over a couple little stretches and exercises that'll help with your warm-up and as well as your mobility during or after the round of golf. So the first one I'm gonna hit on is for your thoracic spine. That's the middle of your back, kind of right between your shoulder blades. When you warm up, when you first get to the golf course, what I would advise you doing is you just take your driver or your longest iron, put it on your back, and then what I want you to do is you kind of get in your normal setup as you would for your swing, and then what you want to do is you want to be able to rotate enough that that club's pointing all the way down to the ground when you go through, and then go all the way back the other way, just like that. So you're really opening up your hips and your thoracic spine there with both those. Even if you're right or left-handed, I still want you to go both ways, because if you can't open up fully both ways, it's going to restrict your backswing or your follow-through. I'll just go through this at the pace that you should when you start your warm-up. Club on the back, rotate and make sure that's pointing all the way to the ground, all the way back through again. Doing that 10 to 15 times just to loosen up that upper back, mid-back. Something else that I would advise, this wouldn't be ideal right before your round of golf, but at home or in between rounds, different things like that, is using a foam roller. Using a foam roller for mobility in your upper back, hips, legs, anywhere that's really tight on you will really help kind of mobilize those areas. So I'm going to go over a couple different movements for that, especially for my golfers. So I'll get down on the ground here. When you're using the foam roller for your upper back between the shoulders there, you kind of start just below your shoulder blades, arms crossed, stay a little curled up, and you roll side to side, generally getting that motion in there, hitting anything that's tight. Start at the bottom of your shoulder blades for me, and then what I want you to do is imagine you're going segment by segment up your spine, and you kind of extend back to really mobilize and get that mid-back moving good for us there. Then to move this to the hips, what you would do is you would lay on your side, hit a little bit more of your glutes going through there, and even rolling on the side to hit some of the IT band, the lateral part of the hip as well. When you're working on your IT band, you want to stay on the medial area, so more of your quad, more of the hamstring, more of the glute. You don't want to get right on the tendon because that tendon's always going to be tight. You want to hit the muscle areas that connect to it, and that'll loosen up so you won't feel that stiffness on the side of your hips. Next, with the hip stretches, what we want to do is call it a 90-90 stretch. So you get your front leg 90, back leg at 90, and what we do here is you rock forward, go into transition, moving side to side here. Rotating back and forth, that gets your anterior and posterior capsule of your hip opened up pretty good for us, so that when we go through our hip swings that we can get that full torque back and full torque forward, so you can really explode through that golf course and open up the hips when you come down and make connection there. The other one that I would add would be a pigeon stretch. You take your leg over, bent knee in front of you, and then to really insinuate it, you can bend down. You can even go down all the way to the forearms. That's going to hit your piriformis, back of the glute area, as well as the lateral part of your hip. Next, we'll go through some thoracic openers as well that you can add in at home instead of just doing the thoracic mobility there as well. And what you want to do with this one is you have your hand on the back of your head and you're going to go down, touch opposite knee, and then try to point up to the ceiling. So I'll walk through this real quick and then I'll explain it a little bit after. Come down, touch the knee, all the way up, pointing elbow straight up to the ceiling if we can. If you can't, doing that both ways, both arms, if you're not able to do that to get that full range, that's when you need to come into the office for us to do some soft tissue work to loosen up the different muscles that could be causing that, maybe some adjustments to the thoracic spine to get that area a little bit more mobile for us. Those are the general mobility things I advise for my golfers. Different things that we would add when you came in, depending on what was going on with the game or where you were having problems, is to work on intra-abdominal pressure, your diaphragmatic breathing, strengthening maybe different lung muscles, different hip muscles, so that you can really have that explosiveness going through there. But that would be more tailored to your specific things and your specific problems. So if you're having any of those mobility issues or strength issues, give us a call. Thanks.